सो हेलो गाइस, वेलकम टू डॉक्टर डेंटल स्माइल चेंजेस द मूड। सो गाइस, आज हम इस वीडियो में डॉक्टर विनायक एम सर के साथ डिस्कस किए हैं कि कैसे हमको बीडीएस ज्वाइन करना चाहिए 2023 में कि नहीं, और क्या और हम जो जो बच्चे बीडीएस ऑलरेडी ज्वाइन कर चुके हैं तो उन लोगों को कैसा बीडीएस प्रोफेशनल कोर्स में कैसा पढ़ना चाहिए। तो आज हमारे साथ डॉक्टर विनायक एम सर ज्वाइन हुए हैं, जो कि एमडीएस किए हैं पेरियोडोंटोलॉजी एंड इम्प्लांटोलॉजी में। ही इज़ ऑल्सो एन इंटरनेशनल एसोसिएट फेलो ऑफ वर्ल्ड क्लिनिकल लेजर इंस्टीट्यूट। ही इज़ ऑल्सो the PhD, doing currently PhD at Yanopaya University. He is also a certified implantologist from ICOI New York. He is also completed DNHE, that is Diploma in Nutrition and Health Education. He is also the fellow of Hairline Institute Bangalore, also the fellow of International Academy of Higher Education Manipal FAGE, also the life member of Indian Society of Periodontology, and have published scientific papers, books, copyright and patent to his credit. And he had also three multinational multi-speciality dental clinics in Bhavnagar, Bagalkot and Guledguda, Karnataka. He performs all the clinical, surgical, laser, PRF and cosmetic procedures. So guys, stay with us and watch this video till last, and don't forget to like, share and subscribe the channel, and also click on the bell icon to get the notifications first. Actually sir, in Odisha there is a bad
Hello, is
weather
it
now,
audible?
that's why sir there is an interruption. So sir, we are continuing with the fact about that awareness
Okay,
about BTS admission. Actually, so many
can we start?
people और हमारे जो सोसाइटी के लोग होते हैं वो भी सर बोलते हैं कि 32 सिर्फ 32 टीथ के लिए क्या इतना खर्चा करना है, और 32 टीथ के लिए मतलब इतना लाख रुपया दे के पढ़ाई करना, क्या ये सच में कुछ हम कर सकते हैं कि नहीं कर सकते हैं। बहुत लोग बहुत क्वेश्चंस भी पूछते हैं उसके लिए सर।
See, पहले बात है लाखों का पढ़ाई होता है ना, it is optional. If you're rich enough, you can get into the management seats, or else you can ace your grades or the ranks. You definitely end up with a good government seat. So apart from that, a 32 दांतों का पढ़ाई and all, I think the government should take an initiative to put some syllabi regarding the dentistry, and it is happening. When I see my younger brother's syllabus of 10th standard and all, they are getting what is gingiva, they are knowing, and what are the different types of teeth. Now it has been improving. Upcoming days, I think definitely there will be a lot of scope for awareness to be entitled from the government. So that can be expected, and it shall resolve very soon. And college also should take some initiatives. The schools at school level, some awareness programs from the dental college, especially from the government dental
Yes
colleges.
sir.
They should
Actually
arrange awareness,
sir, I am thinking
the internship programs for the awareness, or the
yes sir, actually sir, I am
some
thinking
tour guide
when I was in
programs
first
like
year
those
I
things
saw
they
that
should.
we are reading just human anatomy, physiology, biochemistry and also dental anatomy, oral histology. So basically for us dental anatomy and oral histology was a new subject. Anatomy is also a new subject for us, but physiology and biochemistry, somehow there are some topics which we read already in class 11th and 12th. And if yes sir, and also if we will see to second
Yeah,
year,
those
when
are
I
all,
came
yeah,
to second year,
familiar with the
I
term.
saw
Correct.
that dental material. So in basically in that we are all reading about physics and chemistry only, all the inorganic, organic chemistry and all the physics that we have read in our class 11th and 12th. All these things are coming, and we are reading in that. And I don't think that all these things are in MBBS course. It is not happening like physics, chemistry, including mathematics. Some formulas are also required for that, organic chemistry. So all these things that we need in dentistry, but I don't think somehow it is needed in MBBS or Ayurveda degree. And I think if there will be a separate exam, entrance exam for this, then it is going to be a tough exam for BDS in India if there will be a separate entrance exam, sir.
Why there will be a dental materials in the second year? Because you are going to enter into the third year where the
Yes, sir.
academics will, clinicals will going to be start. See, first year will be your
Yes, sir.
paraclinicals, second year will be your preclinicals, third and final year will be your clinicals. The henceforth years has been divided in such a way that you need to have a knowledge. So why there will be different material science is there in dentistry is because without any materials you cannot survive the dentistry also. For every each and simple procedures, you need at least 2 to 3 different materials to be, used upon for the betterment of the patient. So, how there is a pharmacology for the other pathologies such as MBBS, like that. We have a dental materials. Really, we have to know whether this specific material is non-allergic to the patient or whether any carcinogenic material is there, whether in the futuristic usage of that material, for example, the cements what we are going to use, it is going to stay at least for a decade in the patient's mouth. To know all these things, if there is a definite need, which has to read properly, thoroughly the dental material subject. And regarding the even another question,
Yes.
having a separate exams, I don't agree. We need a second any other separate exams because in the basic chemistry, physics, and biology has to be there in all the fraternities to be entitled for the doctorate degree. So it is okay to have one uniform entrance. So it is good for us, not to reading twice or thrice for MBBS, for Ayurveda, for dentistry. So it is one exam is good the concept. I don't agree with separate
Yes,
exams.
sir. Sir,
Everything
now
should be
another
one.
one important question that most uh, YouTubers, dental surgeons that or dental students that get in their YouTube channel is that dentists should use stethoscope or not. That's how like stethoscope is like a craze for medical or dental students or Ayurveda students. That doctor means they should use stethoscope.
You have to use, see, before touching any patient, yeah, you have to use. That is why in third year you will be, teached how to take a blood pressure, you by using sphygmomanometer. Without taking a blood pressure note, you cannot do any simple extraction. If the blood pressure is high, the bleeding won't be stopped at what is the minimum bleeding time and clotting time at that level. You have to know because see, these things are not been fantasized like how MBBS people will be fantasizing, wearing always the and roaming around. But tests you have to do apart from the dental examination, general physical body examination.
Sir, my next question is that in South India, there is a more craze for
Yeah,
dentistry.
yeah, it's okay.
If you will see, and in rest parts of India, if you will compare, then South India is having more craze about dentistry. Even in my college, if I will say,
That is absolute nonsense. When I took dentistry, my parents are not at all happy. Why dental? Dental, this was the question I used to get to hear from all. There is nothing such, okay. We South Indians doesn't have this thought at all.
yes,
Dentistry is like, last thing you will do it. At least, parents'
yes, sir,
mentality. They will be happy when we choose
yes, sir.
engineering
There is
over
a
BDS. We used to get a lot of, it is a myth. My dear, it
I
is a
also,
myth. There
sir.
is nothing such called, South Indians are crazy experience. No, not at all. We are hardworking. We are very much hardworking. Whatever the
Actually,
fees we
I
are
had
getting,
also
that much I
like
can say.
comments like that
But there
ये
is
लोग
no
खुद
such
के ऊपर
craze.
क्यों कीचड़ उछाले उनको
Not
तो
at
खुद
all.
को अच्छे बोलेंगे ही दूसरों को सामने क्योंकि वो तो अभी इस फील्ड में आ चुके हैं ऐसा भी कमेंट्स आता है सो सर
See, you cannot listen the everything, whatever the dark
यस
box. No? Whenever the dark box, you should,
यस
throw
सर
some stone and you should move on because you are already took the course. Be the best of your version. No? Be the best version of yourself. So you can, inculcate a little bit of knowledge and you can come out and spread the knowledge and awareness. See, one thing you remember, the person might not go to a gynecologist or pathologist or pulmonologist or
यस
diagnostician, whatever. Like, but the person in his lifetime, he definitely gonna visit the dentist. That much I has to say because there will be a dental problem in any part of in his life or lifespan at any age. People does come for the dentist. So that will be there. That he cannot or she cannot change. Oh, whomsoever will talk nonsense about. You should not talk anything bad about any field. Okay, everybody and every field needs some substance, because see, we all are living in a world where we all need each other. So
Yes,
we
sir.
cannot degrade somebody
So,
and
sir, let's move on
upgrade
to our
someone.
next
Like,
topic, that how we
so I
should
don't agree
read.
with that.
I am also a second year student. So, sir, you will also guide us in how we should read in our BDS professional course. So, sir, please share us that in, for example, in first year it was not so hectic, though we are new to the course, but it was not so hectic for us. But certainly when we entered into second year, we are like having preclinical prosthetic works, we are having preclinical conservative works, also dental materials practical, and above all that pharmacology, which is a vast course, and pathology, microbiology. So how we should, sir, handle all these things, and also in our next year and also in final year, it is going to increase day by day our burden. So how we should handle it, sir?
See, there is only one formula, okay? For all the years, there is only one formula. There are two types of reading. One is for the knowledge sake, what you will read throughout the year, and one reading for your examinations. First, we'll crack the examination part. See, whenever the exams are going to announce, at least you will be aware at least 3 months prior with the date of announcement. At least within the 3 months, 3 months of span, you have to take out at least 10 years university question papers to look up the concepts which are very much popularized in the previous question papers and work on it to be get pass, just pass marks. If you want to have it, this homework is more than enough, because see, in medicine or the dentistry, the concepts never changes that much for the UG level. Yeah, for post graduations and the PhD, definitely the concept will, with the upgradation only we have to write about and talk about. For the UG level, the textbook prints, whatever it is already there, which is not much has been changed so far. So the concept will be there as it is. So if you work all those question papers, the 10 years branding question papers will be more than enough for the exam point of view. So how do you study for the knowledge sake? That thing will start from the first day of your any such year, second year, third year, final year. And one thing, my dear, you have to be very passionate about the field. Then only you will sit
Yes, sir.
and try to open and know some things. For any such field, without any passion, it cannot work. And you have to plan. There is a 365 days curriculum. You have to plan for it. You cannot just randomly read something for because the ma'am has told, sir has told for discussion, let us read. No, don't do that. Just have a habit of at least reading 2 to 3 pages. Forget 2 to 3 pages, at least 1 page a day. You keep it like that. Hardly it will take to finish all the subjects. So well begun is half done. That I always believe. So if you prepare well, the exam results no need to even think of it. Okay, the results shall come and it will come only if you have your
Yes,
preparation
sir. So
done well at
another
the
one
very
question
early
that,
beginnings of
sir, what is the
years.
most appropriate time to prepare for NEET PG examination, NEET MDS examination, sir?
If you ask me, the early internship days are the best one, because starting 3 months you just enjoy, and next other 10 to 9 months you have to sit properly and do the pulse properly. If you ask me personally, I think doing pulse thoroughly at least twice or thrice is very much important. And nowadays the concepts are also being varied and upgraded. So you need some certain coaching centers help also to get to know the new concepts or to clear out some concepts. If you're there in some competition, then only will try to be more active and read little further for the examinations. The starting 3 months will be your honeymoon period in the internship. You cannot just force yourself and start reading. Let me read, start for the NEET PG in the first half only. Okay, you take your time, breathe yourself, then start thoroughly with a very continued fashion. Daily one chapter or one concept. Keep it like that and move on with the pulse. I think that will give you a lot of confidence. While you start finishing the chapters one by one, you will gain the concept and it is directly proportional. The more you finish, the more confidence you shall gain. That is a simple mantra which I followed, and I think that is more than enough if you ask me. Once you start with your proper preparation with the pulse, followed by
Uh,
guidance with the coaching centers, you'll
yes.
definitely ace you
Sir,
with
one
the
more thing,
government
sir.
schools
As we
in
can
any
say
other
that
states
BDS
or
is almost
any
itself
colleges.
for specialization because it's almost a separate, we get a separate degree for it. So, sir, is it necessary to do MDS? Many of us, many people or many students comment that should we do MDS after completing BDS? Is it necessary or not, sir?
It is completely optional, my dear. Those who have completed BDS along with me, they are also doing really well, having the clinics. There, even the female candidates I'm talking. I would very happily mention my fellow friend Dr. Vidya. She has opened a clinic at very early stage, and she is doing really good. These are the people who makes me also motivation. Even one of the doctor called Dr. Kumuda ma'am. She is in Kustagi near to my place where I'm working. These are the only BDS ladies do. These ladies can do it means everybody can do it, I guess. What else? All you need is a courage and a good sound knowledge. See, once you have a clinic on the BDS level, just know what case you can do it and what case you cannot. That judgment you should call it. You don't run for the money. Money is not always a thing. You need to earn a good name for the clinic. So always consult the specialist, call them, get the OPD done from them, get an opinion. Then you can think of it whether you can able to do the case or you need another consultant to come and finish it up. So that part, that is a very minute line between the money and the name.
Uh,
So that you understood with the BDS degree, your clinic will run successfully. That is no doubt. And in terms of MDS, yeah, definitely if you're very much interested into the academics or into the research field, yeah, MDS is very much necessary. But only MDS is not sufficient nowadays. You need to gain a PhD. After PhD, again there is a clause of postdoc. So there is a lot of journey where you are academically
uh,
active. There is always gates are
y-
open for so many things ahead. This much, yeah. These many the doors are always there for the BDS. Even see, if you're BDS, if you want to enhance any of your interested courses in the cosmetics or the endodontics, all these things, you
yes,
can work for it.
sir.
You can do the fellowship of the implants or the cosmetics or the endodontics. You can practice. All these minute cases you can start. Don't start with the higher end cases. Start with the minute cases. Then come up with the higher end cases. Once you
Sir,
start experiencing
last
things, that much you can
last one more
do it at a
question
BDS
for
level. A lot
those who
of
are
things can be
preparing NEET
do
UG
at
entrance
BDS
examination.
level.
That many are commenting that what next BDS. So, sir, please give a brief description again for
Hmm.
this question. That what after next? What next we can do after joining BDS or after completing BDS?
See, there are a lot of options, as I already like mentioned now only. See, once the first thing, if you're very much confident, you just open your own setup, or if you need some confidence, you go to the some of the dentists near to your place and request them to be, have an observership. Be there for 3 months, 6 months. You just learn how things works, how the OPD will be done, how the structure of the clinic will be. All these things you can read. That is one thing. And if you want to academically active and continue something into the research, there is always option of MDS. You can opt the MDS, and further also there is the option of having a PhD and also. If you want to earn money at a very early phase with a difficult economical situation, so better you choose the clinic with
Yes, sir.
along with your good surrounding of the consultants with the relatable subjects. Nowadays, there are also government exams. After BDS, you can also try for the KAS, IAS. KAS is a Karnataka state exam on the government jobs. Like how IAS is Administrative Services of the State and IAS. All these exams. and sometimes there will be call for the consultant dentist on the BDS basis from the government of each states.
Yes,
Like this, you
sir.
can think of,
Yes,
and sometimes DRDO, if you heard of that, DRDO will also announces few of the JR ships. AIMS also announces JR ships. You need to be very active in all these websites. Then only you'll get to know. Like there are so many groups in the Facebook also. They can help you out with the notifications and stuff. So these many options are there. At the end of the day, you should know what you want to do and what you want to extract from the videos. So the whole extraction will start from your first year. You need to be very much passionate. Don't keep on dragging that. Okay, I choose BDS. I don't want to do it. No, leave that thing from your mind. Okay, you are already joined BDS, so you will end up with the BDS only. So be more passionate, be more extra
yes, sir.
cautious
Thank
while
you
you're
so
learning
much, sir.
things. So if you
Yes, sir.
learn better,
Thank
you
you
will
so
earn
much,
better.
sir, for giving. Yes, sir.
There is only L in between. Yeah. If you learn better, you will earn better.
Yes,
That
sir.
is the quote. I think it will end.
Thank you so much, sir, for giving your valuable time to me, and we are also grateful, sir.
Thank you, and I really appreciate your concern
Thank you.
regarding the field of dentistry. At very engaged, that's why I'm being the supportiveness. I agreed to come with you on live because
Yes,
see, this is the way we can encourage our budding dentists or the budding BDS. So I'm always there to help you guys. If anything is there, you can DM me in my Instagram ID, which is already showing here, Dr. Avida. Anytime, anything you need to be concerned about or discuss about,
yes, sir.
always welcome. You
Thank you,
can
sir. Thank
contact
you
him
so much
also.
for
He
joining
will
with me,
also
sir.
guide
Thank you,
via
sir.
me. That is also fine.